Hey everyone, let's be real for a second. Navigating the world of health insurance can honestly feel like you're wandering through this massive, overwhelming maze. But getting the right coverage, that brings true peace of mind and real security for you and your family. So in this explainer, we're going to demystify the entire NY State of Health application process, literally from start to finish.
If you're feeling a little stressed right now about securing coverage, just take a deep breath. Seriously, navigating the marketplace absolutely doesn't have to be this overwhelming, pull-your-hair-out kind of experience. Think of this explainer as your ultimate hand-holding guidebook. By the time we wrap up, even if you are a total beginner to health insurance, you're going to have the exact, actionable steps you need to get covered, completely stress-free.
Okay, let's dive into this. Here is our game plan for today. We're going to conquer this process in 6 clear, totally manageable steps. The NY State Marketplace. Who qualifies for coverage? Preparing and navigating, comparing health plans, enrollment and beyond, and finally, troubleshooting and next steps.
All right, kicking things off with Section 1, the NY State Marketplace, which is essentially your centralized health clearinghouse. So, what actually is the New York State of Health? Well, it's the state's official centralized administrative exchange. You can basically think of it as a giant, one-stop shop managing health coverage for over 6.7 million New Yorkers. It's incredibly smart because it automatically evaluates you for 4 core programs all at once: Medicaid, the Essential Plan, Child Health Plus, and private qualified health plans. And what's truly remarkable here is that by putting all these public and private programs under one roof, this system has successfully driven New York's uninsured rate down to a historic low of under 5%. Moving right along to Section 2, who qualifies for coverage? Spoiler alert, it's all about understanding your household income thresholds.
Your eligibility completely depends on your household size and your income relative to the federal poverty level. Now, what's really interesting is seeing exactly where those cutoff lines fall. Just to put it into perspective, if you look at a family size of 1, an individual earning up to $22,024 qualifies for premium-free Medicaid. Meanwhile, the Essential Plan, which is fantastic because it also features $0 monthly premiums and really minimal cost sharing, covers individuals earning up to $31,920. And of course, as your family size grows, those income limits scale right up with you.
And hey, we definitely can't forget about the kids, right? For children under 19, New York offers Child Health Plus. This gives them comprehensive pediatric coverage that scales incredibly affordably based on your family's income. If you're in a lower income bracket, the premium is literally $0. As income increases, the premium does scale up slightly, but only to $15 or $30 a month per child. It's heavily subsidized, and they even include family maximum caps, so your monthly costs won't ever spiral out of control.
Let's shift gears to Section 3, preparing and navigating. This is all about setting you up for success before you even click apply.
Listen, getting your information gathered beforehand is the absolute secret sauce to making this a smooth experience. The marketplace runs your data against federal and state databases behind the scenes, so matching everything exactly is going to save you from some super frustrating system delays later. First, grab the basics: full names, birth dates, and social security numbers for everyone in your household. If it applies to you, have your naturalization or permanent resident cards handy. For income, you'll need 4 consecutive weekly pay stubs or 2 biweekly ones. Self-employed? No problem. Just pull your Schedule C or your business ledgers. And finally, keep any current health insurance policy numbers right there on your desk.
All right, you've got your documents. Now you're going to move chronologically through the online portal. Step 1 is creating a secure ny.gov ID. Step 2 is super crucial. You have to pass a multi-tier identity proofing process. Basically, the system first tries to verify you electronically through Experian or the DMV. But hey, if that fails, don't panic. You can easily verify by phone or just manually upload those documents you gathered. Then, for Step 3, you simply punch in all that demographic and household data. And finally, Step 4, income verification. The system uses the Federal Hub, but you can also use a really cool automated tool called Truth. It securely links directly to your payroll to verify your income instantly. It's a real time saver.
Once your data is all verified, we reach Section 4, comparing health plans. You've survived the data entry, and now you actually get to find the coverage that fits your life.
If you end up enrolling in a private qualified health plan, you're going to see your options neatly categorized by metal tiers. And this brilliantly illustrates the classic trade-off between your monthly premium costs up front and your out-of-pocket expenses when you actually go to the doctor. A Platinum plan, for instance, covers about 90% of your costs, leaving you with just 10% out of pocket. But it comes with the highest monthly premium. On the flip side, a Bronze plan gives you the lowest monthly premium, but you're going to be on the hook for about 40% of your care costs out of pocket until you hit your deductible.
Now here is a massive pro tip for lower-income applicants who maybe don't quite qualify for Medicaid or the Essential Plan. Keep your eyes peeled for Enhanced Cost-Sharing Reduction Plans, or CSRs. A perfect example is the Silver Supreme Plan. It's available if you earn up to 350% of the federal poverty level, and it drastically lowers your out-of-pocket costs. We're talking dropping deductibles down to just $450 and primary care visits to a $15 copay. These enhanced plans even offer $0 out-of-pocket costs for diabetic and maternal care. Honestly, it's a game changer.
Okay, let's jump into Section 5, Enrollment and Beyond. Let's talk about timelines and what you actually have to do once that insurance card arrives in the mail.
Getting the timing right here is absolutely critical. If you qualify for one of the public plans, so Medicaid, the Essential Plan, or Child Health Plus, you can enroll literally year-round. There is no deadline. However, private qualified health plans have a very strict winter window. Annual open enrollment kicks off on November 1st. If you want your coverage to start exactly on January 1st, you absolutely have to apply by December 15th, no exceptions. And the whole open enrollment period officially shuts down on January 31st.
Okay, so you're enrolled. Awesome. But you've got to maintain it. First off, pay your premium on time if you have one. Second, and I really want to emphasize why this matters, you must keep your mailing address and your email updated in their system. If you miss a piece of mail because you moved, you can actually lose your coverage entirely. It's called procedural disenrollment, and it is totally avoidable. You can even text the word START to 1-866-988-0327 to get handy deadline alerts. Also, just a heads up on the horizon, be prepared for some upcoming federal policy changes. Starting in 2027, some Medicaid enrollees will face new biannual renewals and work requirements. Finally, we've made it to Section 6, Troubleshooting and Next Steps. Because sometimes life throws a curveball, and you need a safety net.
So, what happens if you completely miss that standard open enrollment window for private plans? Well, experiencing a major life event actually unlocks a 60-day special enrollment window for you. These qualifying life events include things like the involuntary loss of your previous health coverage, major shifts in your household like getting married or having a baby, a permanent relocation to a new address, or changes in your legal immigration status. Basically, as long as you submit the right proof within 60 days of that event happening, you can still get covered outside those normal winter deadlines.
And please, remember this, if you ever get stuck at any point, whether you're just totally confused by an eligibility notice or the website is acting up while you're trying to upload a document, do not panic. Free expert guidance is available. You can connect with certified assisters or navigators right in your local community, and they will walk you through the whole process at absolutely no cost. You can also just pick up the phone and call the official customer support line at 855-355-5777.
So, with all these comprehensive coverage options and step-by-step navigation clearly mapped out for you, isn't it time you took control of your health and secured your peace of mind today? Don't put it off. Head right over to the NY State of Health website and get that application started.
This explainer is for informational purposes only and does not constitute legal or professional health insurance advice. Viewers should consider contacting NY State of Health directly or consulting with a professional for specific advice tailored to their personal circumstances.